Today we're going to talk about a procedure that, it's not just about clinical skill. It's really about preserving a person's dignity and empowering them. We are talking about ostomy care, and we're going to see how the smallest details can make the absolute biggest difference in someone's life.
So that really is the big question, isn't it? How do we take something that could feel like just another task on a checklist and turn it into a moment of genuinely compassionate care? Well, let's dive in and figure that out. Okay, so first things first, let's get on the same page. Officially, ostomy care has three main jobs: stop any infections from happening, keep a close eye on the output, and check in on the patient's nutrition and hydration levels. That's our clinical foundation. And here's how we're going to break it all down. First, we'll get into the why of it all, because understanding the purpose is everything. Then, we'll walk through getting prepared and the procedure itself step by step. After that, we'll cover documentation and the risks to watch out for. And we're going to wrap it all up with what I think is the most important piece of this whole puzzle, making sure our care is centered on the patient.
So, let's kick things off with that why. See, when we really get the purpose behind our actions, we can do our jobs not just with skill, but with real, genuine empathy.
All right, now let's talk prep, because amazing care doesn't just happen by accident, it is planned. And a little bit of thoughtful preparation can make a huge difference in how comfortable and confident your patient feels.
Think of this checklist as your safety net. Before you even start, you need to know what you're walking into. Why are we doing this right now? What does the stoma look like? And this is so important. Does the patient have any allergies to latex or adhesives? A few simple questions up front can prevent so many problems later.
Having all your supplies ready to go before you even walk in the room is a huge sign of respect. It makes the whole process smoother, way less stressful for everybody, and it really shows the patient that you value their time and their comfort.
Okay, we've done our homework, we're prepped, we're ready. Now it's time for the main event, the step-by-step guide. We're going to break this down into really simple, easy-to-follow actions.
But before we get into the nitty-gritty, let's just orient ourselves. This picture shows you the two main players here. You've got the stoma, that's the opening on the abdomen, and the ostomy bag or appliance that collects the waste. If you understand these two parts, you are well on your way.
Okay, part one. It's all about safety and respect. We confirm the patient's ID, we give them privacy, we get them comfortable. And hey, I want you to pay close attention to step 6. You gently push the skin away from the bag, not pull the bag off the skin. It seems like a small thing, but that simple move helps prevent painful skin tears and just makes the whole experience so much better for the patient.
Now on to cleaning. The name of the game here is gentle. Just use warm water and then, and this is key, pat the skin completely dry. Don't rub it. You need that surface to be totally dry to get a good seal and prevent irritation. And when you're cutting the new opening, make it just about 1/8 of an inch larger than the stoma. That gives it a little breathing room and stops any uncomfortable pinching.
And finally, we apply the new appliance. Now look at step 2, holding even pressure for a full 5 minutes. I know it seems like a long time, but this is what warms up the adhesive and creates that secure, leak-proof seal. And that seal is absolutely everything for the patient's comfort, their confidence, and their dignity.
So, the procedure's done, but we are not finished yet. Now comes the crucial follow-through that ensures your patient's long-term health and safety, good documentation, and being on the lookout for risks.
So what exactly are we writing down? Well, all of this. And trust me, this isn't just busy work. It's a story. The color of the stoma, what the output looked like, how the patient handled it. All these details create a crystal clear picture for the next person, which means the patient gets consistent, really well-informed care.
And why is that story so important? Because it helps us watch out for the two biggest risks here: infection and skin breakdown. A healthy stoma should have a nice, moist, kind of juicy red color. But if you document that it's looking pale or dark or even bluish, that could be a red flag for poor blood flow. Or if you note any swelling or a bad odor, that could be an infection. Any redness or broken skin around the stoma tells us there's a problem with skin integrity. By documenting this stuff, we can catch these issues super early.
And that brings us to our last and I think most important section. We've gone over the clinical steps, but honestly, none of that matters if we don't focus on the human element. Patient-centered care isn't some bonus feature. It is the absolute key to making this a healing experience.
This quote right here, it just says it all. We have to remember, we're not working on a patient. We're partnering with a person who lives with this every single day and knows their body and the routine better than anyone. Honoring that, asking them how they do it, that's a powerful way to show respect.
Really, it all comes down to trust, and trust is built on communication. So explain what you're doing. Let them know what a healthy stoma looks like. That juicy red color can be really reassuring. Promise them their privacy. Be their cheerleader. And whenever you can, encourage them to participate in their own care. That sense of independence and control is so incredibly important for their well-being after a surgery like this.
So I want to leave you with this final thought. We know the steps, we know the supplies, we know the risks. But the real art of this work comes down to this one question. Beyond all the clinical stuff, how can we, in every single little interaction, best support a patient's dignity?